What is this? NG tubes, let's talk about it. This is a 14 French NG tube. Typically we use 16, you use 14, whatever you want to use, whatever's ordered, whatever is best for the patient, okay? And you're gonna measure it from the tip all the way down to about here. It's 55 for me, but a lot of people sit at about 65, bigger people maybe 70, okay? Easy peasy. And don't mind my red face. I sprayed a perfume in Target before I got home and I'm like allergic or something. My body's not happy after I did that. Anyways, moving on. So when I'm getting ready to put one of these in my patient, I run this under hot water. So when I'm setting up all my stuff, I have everything, I run hot water and I run this under here because this is hard and it helps soften this and make it more comfortable for the patient. So once I've let it sit and run under hot water, I will do this, okay? And make it real flimsy so it's not as painful and rough. Thing I do is I ask my physician if it's okay to order Vicious lidocaine. That is the lidocaine that you can drink and it helps numb the patient's throat. Some doctors will also give you medication you can spray in their nose, help numb that area, as long as it's not contraindicated. Typically when doing an NG tube, they allow you to drink a little bit of water. So it wouldn't be any different with the Vicious lidocaine. And anytime I've given that Vicious lidocaine, it always works. And you're in the ER, you learn a lot of little tips and tricks such as the Vicious lidocaine. I've told ICU nurses, I've told floor nurses, and they're always shocked and then they use it. It's always worked for me and I don't have to usually have them drink water. When you're inserting this, make sure that when your patient's head is down, that their shoulders are back as well and they're not crouched over because you have a strong chance of this coiling and coming out of their mouth. So you want them to sit back a little, not straight up, and they're crouching down. Sit back, shoulders back, head down, chin down, okay? And they can drink water. I don't really think it's that beneficial, but everybody's practice is different. Have them drink that water. They already have Vicious lidocaine. It's already numb. And you put this tip in and you start going down straight away, okay? You don't just, it does not go up. You will put it in the tip of this nose and go straight down and start going. If you get any resistance, please stop, okay? If you hear the patient choking, please stop. Once you get this down and if you see you're at your mark and what you marked on for your patient, 65, 55, 70, whatever it is that they sit at, you see the end of this, I want you to clamp it. Now, again, disclaimer, this is my practice. This is not everybody else's practice. I know typically we take a syringe, we push air into it, we want to hear. I personally do not do that. Small tips. If you put this in and you see white frothy stuff with bubbles, you're in the lung. Remove it. You're in the lung. You don't need to push air in there. Please don't. Please don't. In the stomach, okay? And this patient has a bowel obstruction. 99% chance that if this right here is closed off like this, anytime I'm done with the NG tube, it looks like this, right? I take this off fast and I hook it up to suction. Mind you, the suction is not on, guys. Make sure your suction is off. Suction off. Attach it with your football, okay? Put it in, attach it. Don't turn the suction on. I'm not gonna tell you again. And you will see GI contents come out, right? You'll get all the things. It will come out. You'll know if you're in the stomach or if you're in the lung. If you don't get anything at all and you're unsure if that patient needs radiology or any kind of chest imaging, let them verify it. Or you can do the old school thing and use the syringe and listen. I personally just don't like to put air in people's stomach or their lung, gosh forbid. Very rare chance if you get in the lung, but sometimes you can. It is what it is. Just remove it right away. That's why I don't like to do the syringe pushing the air in, because anytime I've done it and I'm in the right place, you see GI contents come out without any suction. Okay, you'll see it. White frothy, remove it. We got this.